The Department of Labor is developing an emergency rule to require all employers with 100 or more employees that together employ over 80 million workers to ensure their workforces are fully vaccinated.
US President Joe Biden faces pushback as he gets tough with the unvaccinated. Plus, the pandemic rages on amid calls for more global cooperation. Hello, I'm Nathan King, sitting in for Anna Naidu, and this is The Heat. Hello again. In his most forceful pandemic actions to date, US President Biden ordered sweeping new national vaccine requirements for as many as 100 million Americans in an all-out effort to combat COVID-19. But the mere mention of mandates was met with sharp cries of government overreach by the president's political opposition. Meanwhile, at the United Nations, the Secretary General called for an immediate global vaccination plan to at least double production in an effort to reach 70% of the world's population in the first half of next year. There's so much to talk about, so let's get straight to our panel. Chris Smith is a consultant clinical virologist at the University of Cambridge and the co-presenter of Naked Scientist podcast, hence he's in a radio studio. And Einar Tangen is a political and economic affairs commentator who we know very well, good friend of the show. And also with us is William Haseltine. He is the chair and president of Access Health International. We also, of course, have Chris Smith from, Joseph Williams from US News and World Report. Sorry, Joseph, there, the prompter went down and I didn't look at my script quickly enough. But as a consolation, I'm going to start with you because let's set the political frame. For months since Biden took office, he's resisted this, but the numbers can't lie. And before I get to your question, let's just play a question he was put just a few days ago.
Thank you very much.
Mr. President, what is your message to Republicans who are calling your vaccine requirements an overreach, who are threatening to challenge it in court?
Have at it. Look, I am so disappointed that particularly some Republican governors have been so cavalier with the health of these kids, so cavalier with the health of their communities. We're playing for real here. This isn't a game. And I don't know of any scientist out there in this field that doesn't think it makes considerable sense to do the 6 things I've suggested.
So, Joseph Williams, is this gloves off time for Biden, and what's it all about? Is it about crushing COVID, or is it really about the political fight as well?
I think the answer to both of those questions is yes. I mean, yes, it is about a political fight, and yes, it is about crushing COVID. Look, the science is very clear. This is a pandemic of the unvaccinated. Hospital emergency rooms are getting crushed by people who did not take the vaccine. The people are going across state lines to find treatment because there are so many unvaccinated people in hospitals. 99% of the people in COVID ICU units have not been vaccinated. And because of that, it's causing a ripple effect not only through the economy in terms of shutdowns, in terms of closing dining rooms, in terms of people not being able to go and recreate like they want to, airline fares down, the whole bit. It's not only that, but it's also people who need life-saving surgery in some cases can't get it because hospitals are filled to the brim with people who have not been vaccinated. I was listening to a report on the way over that talked about a nursing shortage. I wrote about that myself some days ago, where nurses are burned out. So in order to get control of this virus, people have to believe the science. But in order for them to believe the science, Biden feels he has to get tough with Republican governors who have fought back against the science, some of them almost at every turn. They fought vaccine mandates, they fought vaccine mandates, they fought mask mandates, they fought social distancing, they reopened very early. And if you overlaid a map of where the biggest COVID hotspots are in the United States, and you overlaid that map with people who voted with counties that voted for President former President Donald Trump, you would see a very clear pattern. You would see a correlation where all those states where Trump was a big hit in 2016 and in 2021, or rather 2020, they're the same states that have lower vaccination rates because the president didn't necessarily do all that he could have to convince people that this was a good idea. And vaccine conspiracy theories are still out there. They have not been quashed. Vaccine hesitancy is still a thing that has not been quashed. So Biden apparently, although he didn't want to make this move, as you mentioned earlier, felt like he had no choice because the success of his first-term agenda is very much at stake here.
Right. Bill, I want to come to you because you've got this new book out called Variants, and it's the Delta variant that has literally destroyed the recovery from COVID-19, not just here in the United States, but of course everywhere around the world. The figures are still alarming, even though they seem to have maybe reached a peak, especially when it comes to hospitalizations, considering the vaccines do work if you're vaccinated. Is it just a problem of not enough Americans getting not just one shot, but 2 shots?
Well, that's the problem right now. You've stated it very accurately, and your first speaker was very clear on the results. So it is absolutely the case that if you're not vaccinated, you're at extremely high risk with this very, very infectious virus. That being said, there's a second debate underway right now on a 3rd shot.
Right.
And the newest data that's coming out says you really need it. First of all, this probably should have been a 3-dose vaccine to begin with, because the 3rd dose gives you 10 times the neutralizing antibodies and protection that you had before. And it seems really to work from early data. Secondly, if you happen to be vaccinated and encounter the Delta virus, after about 5-6 months, you're only 40% protected. That's not enough. So there's 2 things going on. There's the unvaccinated being infected at a very high rate and getting sick and occupying the hospital wards and dying. And then there's a doubly vaccinated who, after about 5-6 months, should get a additional shot, a 3rd shot.
Well, Bill, so I think you're absolutely right, obviously, with the science. The problem is we can't convince enough people in US to get 1 shot, let alone get a booster shot. And as you know, I mean, obviously the science is behind the policy here a little bit too, because they have to give the go-ahead. And, you know, my kids went back to school last week, and one of them is vaccinated because he's old enough, but the other one isn't. And there's a lot of people out there worrying about these spike in number of cases. What else does the president need to say? Because, you know, it's very important to put vaccines up front and center, but we're seeing the similar thing in the UK where it's vaccine, 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 get the economy back to normal. But are we going to have to get to lockdown stages again if this doesn't go away?
Well, you know, I've also been promoting something called multimodal COVID control.
Right.
And we are now, and I'm reasonably convinced, vaccines aren't going to be the ultimate answer, just as they aren't for influenza. Influenza is still around, and this is worse than influenza. You need to have a series of systems that include identification, contact tracing, and then a consequence if you've been exposed. That consequence right now is isolation. And we have to make isolation a reality and isolation possible economically and socially. And that's a big step. I just wrote a piece called A Major Gap in Our COVID Defenses. And that gap has always been testing, consequence contact tracing, not really done, consequence isolation. Hopefully it will be prophylactic drug treatment, so you don't have to be isolated, but that's coming, but it's not here yet. Right. That's a giant hole in our COVID prevention system.
Okay, I want to move to Chris in Cambridge in the UK, because Boris Johnson was out unveiling his autumn winter plan, and a lot of it is focused on vaccinations, but there was an ominous warning too, wasn't there, that we may not have the passports, we may not have the contact tracing, but a lockdown could come if we don't get a handle on this.
Yeah, although I remain quite optimistic, because the thing that I'm looking at is not so much how many cases are being declared every day, because if you looked at that, they're eye-watering in the UK now. I mean, we've got 40,000 cases a day, and those are the ones we know about. Admittedly, we're doing stupendously high levels of testing, 1 million tests a day, which means our level of detection, our rate of detection is going to be very high. But you can probably double that case burden, because remember, maybe half of all cases are going to be asymptomatic. But the last time we had 40, 50,000 known cases per day, which was December, January, about 9 months ago, the death toll associated with that case burden was very high indeed. It was maybe 1,000 to 1,500 people per day were dying. That number now is about 100. So in other words, we're tenfold down, at least, on where we were, and that's all down to the vaccines.
Are you also suggesting a bit of herd immunity here, because the vaccine allows you to get it? I know that's, you know, you don't talk about that anymore in the UK, but that was a strategy that many considered and some even went down the path with.
Well, the quandary here is that what we've got is incredibly high levels of vaccine uptake in the individuals who are most at risk. But what we don't know, and this is the big unknown, what we don't know is, do we need to go in with more boosters in comprehensively the entire adult population? Or is the immunological memory that people have now going to be sufficient? Because we know that these vaccines are performing incredibly well. About 95% are protected. In other words, and that's from severe disease. In other words, if you had a run-in with coronavirus unvaccinated compared with a vaccinated state, you're 95% less likely to have a severe problem and end up with severe disease or passing away compared with yourself unvaccinated. So that's a stupendous outcome. But the problem we face is that the vaccines are leaky. And what we've got happening is that about a third of the time, people become susceptible to infection again. Not severe disease, but infection. And that means they can become infected and they can pass on the infection. And that means that we can't use this as a way to stop the virus spreading. What we can aspire to is to stop people dying, which was the original goal of vaccinating people, but we are going to have a strategy that accommodates the fact that, just like the flu, we cannot get rid of this thing, and we are going to have to plan for it being around for at least the foreseeable future.
I'm going to go to Einar now, because essentially the strategy in China is completely opposite of that. In fact, you know, you don't see it written about a lot here in the US press, do you, Einar? But I mean, essentially, China has been COVID-free for quite a while, except whenever cases come, you get these mass testing, mass lockdowns to make sure there isn't community spread. But what we've seen, what we just heard from Chris, is an opposite strategy. How do you square that in terms of where China's coming from, Einar?
Well, you have two very different political systems and also cultural outlooks. I mean, in China and in a lot of Asian countries, the issue is always about, well, the collective outweighs the rights of the individual. And, you know, in any society, you have the struggle between rights and responsibilities, rights of individual responsibilities towards society. It's a little different in China. The government took swift action. They've been very successful, as you pointed out. That's not really discussed much. You know, I've listened, Nathan, I've listened to the experts, and I understand from the science point of view, but what they're really talking about is, you know, necessity. The situation is as it is. You know, in the U.S., it's estimated by the CDC that the true numbers of infected are around 120 million, roughly a third of the population, and that real death tolls are about a third more than they actually are. So, you know, at this juncture, you know, China's taken their own way. It's been successful. The question is, if the rest of the world adopts this kind of herd immunity, will China, in essence, be isolated because it wants to contain the virus?
I think that's an excellent question, because, you know, unless you have this global approach, of course, when borders do open up in China and elsewhere, it's going to be different. Look, you know, the debate here is completely different. I'm going to bring back Joseph, and I want to play Asa Hutchinson, who needs no introduction. He's from Arkansas, Republican, on this mandate, and just get the Republican vitriol against this, which I'll get your take off the bat. Thank you.
I support businesses being able to require vaccination, but it's their own independent choice for their workplace. But to have the federal mandate will be counterproductive. It's going to increase resistance. We talked about the fact that we've historically had vaccination requirements in schools, but those have always come at the state level, never at the national level. And so this is an unprecedented assumption of federal mandate authority that really disrupts and divides the country. It divides our partnership between the federal government and the states, and it increases the division in terms of vaccination when we should all be together trying to increase the vaccination uptake.
Joseph, is this the Republicans having their cake and eating it? Because they can blame President Biden for pushing these mandates, but there's a bit of sigh of relief in some Republican-led states that this might actually take the decision away from them. And I know, speaking at least privately to people in business circles here in DC who didn't want to make the decisions that some airlines have taken and others health systems have taken to mandate their employees to get a vaccine, that essentially you're going to see a huge uptick. Is that what's going to happen? I mean, it seems to be rhetorically and anecdotally happening already.
Well, I think the uptick is going to be real. The question is it going to be nibbling at the edges, or is it going to make a huge difference when people who are so entrenched against the vaccine, to some who I know personally who have said, fire me, I'm not going to take the vaccine, is that going to make the difference? I mean, I think Asa Hutchinson very much was keeping to the script. Yeah. You have a lot of Republican governors, a lot of business people who have to pound their fists and say freedom and say government overreach, when really they all know, and a lot of their futures depend on whether or not this virus gets under control, whether or not people stop getting hospitalized or stop dying in their states, whether or not businesses can reopen, whether or not economic development can happen again. This is all very central to the plan. I've said on this program a couple of times that the virus is going to get the last word, and it is having the last word right now. And until these vaccine mandates get taken care of, we are still going to be in this perpetual cycle of shutdown, maybe isolation, mask, maybe no mask. And the Republicans have a lot to look in the mirror to contemplate here, because a lot of these governors in Republican states, looking at Ron DeSantis in Florida, either mocked the vaccine when it came out, either mocked mask mandates or fought against them when they're very widely known to be effective tools against community spread of viruses. They fought against them, they mocked them, they claimed that the virus is no big deal, and they were following the cues of a man who's very much still in control of the Republican Party, and that's one Donald Trump, who nevertheless, even though he got the vaccine, still was not doing all he could have done to convince people to take it.
Do you think we're going to see a sort of political, do you think the political clash is going to step up, or do you think we may see it mitigate as we head into, fall and winter, where, let's face it, viruses get worse? Do you think there's going to be a little bit of a political timeout, or the election calendar for next year is going to be the dominant virus politically, if you like?
I think we both kind of know the answer to that question, or at least expect the answer to that question, and that is that politics is the name of the game here, even in the midst of a once-in-a-century pandemic that's killing thousands of people a day.
Yeah, I really hoped you weren't going to say that. Bill.
I hoped I wasn't going to have to, but here we are.
I mean, Bill, some people have said, with Biden's move, he's sort of copying other leaders like Emmanuel Macron in France, who, has had everyone carry around this pass sanitaire, which has had, lots of TV headlines of people demonstrating, but essentially that most of the people are behind it. And I want to play you just a clip now of Dr. Anthony Fauci, who needs no introduction, because he's kind of suggesting that there might actually even have to be more. And I'd like to get your reaction off the back of Dr. Fauci. Thank you.
I think the president is being somewhat moderate in his demand, if you want to call it that, in that there are some people who really don't want to get vaccinated, but they don't want to lose their job. You got to give them an off lane. And the off lane is if you get tested frequently enough and find out you're positive, you won't come to work and you won't infect other people. So it really is somewhat of a compromise there. Myself, I would make it just vaccinate or not. But he was trying to be moderate in what his pronouncement was.
Bill, do you agree that essentially Dr. Fauci is saying you could have done more, but politically perhaps it wasn't possible?
That's been the story all along. Yeah. I think this administration, more than the last one, understood what they needed to do. But they've been politically constrained. Whether that's been wise or not, I think the answer is we now have a terrible infection throughout the country, and especially in the southern states, as people have pointed out. And that's been a consequence, so I think it's overdue. I was hoping he would make this move easier. I'd like to go back and pick up just a couple of threads from the earlier conversation.
Sure.
First of all, is there really a need for a booster? If you look at vaccine protection of Delta in Israel and a few other countries from hospitalization. That isn't death or serious disease. It's down to about 50% after 5-6 months, down by 50%. So that is not counting death or serious disease. But in my opinion, what's happening is the vaccine power is waning, which can clearly be seen in a number of cases. So that's one of the reasons I would be in favor now of a third shot, especially for people over 50 who have weaker immune responses. That's the first thing.
Okay.
Secondly, China has got a double strategy now. Yes, they're doing their famous whack-a-mole where they shut down one city after another. They've also vaccinated like crazy. Over 1 billion Chinese have now received at least one shot, and pretty soon 1.5 billion, or almost everybody, is going to get 2 shots. So they're doubling down now on the vaccine strategy. So they're done the control, and they're now doing their vaccination, and they will be using mRNA vaccines, I would say, within the next 5-6 months. So they're doing something that no other country has done. Virtually no COVID in their country. Maybe a handful, 24 people have died in the last 16 months. It's totally distressing to see that a major country with big borders and a lot of international trade can have virtually no COVID, whereas we are suffering unbelievably. And many people we all know have died.
Bill,
died unnecessarily.
Thanks for your points, because I did want to widen this out internationally. I'm going to go to our international guests in a second. But first of all, we've got the UN General Assembly coming up, and, the United Nations is meant to lead at times like this, and it really hasn't when it comes to COVID, and that's not necessarily its fault, but member states who can't seem to agree on how to treat the virus or where it came from, and lots of finger pointing. So I want to just play the UN Secretary General Antonio Guterres about a call for more vaccinations. I'm going to get our international panel off the back of that.
We need an immediate global vaccination plan implemented by an emergency task force made up of present and potential vaccine producers, the World Health Organization, ACT Accelerator partners, and international financial institutions to work with pharmaceutical companies to at least double vaccine production and ensure that vaccines reach 70% of the world's population in the first half of 2022.
Well, Einar, we talked a lot about vaccine diplomacy, but is this diplomatic way of asking for more vaccines in the world to come together and not just do it on an ad hoc basis depending on who your allies or wannabe allies are?
Well, the issue is it's always about a day late and a dollar short. I mean, I commend the UN Secretary General. I commend Biden for saying these things, but they should have been said a lot earlier. Yeah. There's a crisis in leadership that is developing, not developing, it is apparent. I mean, talk about the ironic hypocrisy. You have Republican governors who are saying mandates from the federal government are unacceptable. Yet they're passing mandates telling school districts and businesses you shouldn't or cannot impose mass mandates on others. So, I mean, it's a complete state of confusion, and it's drawing attention to a lot of the
if the vaccines aren't wanted by Americans, let's send them to Latin America, Asia and Africa. Nice. I mean, it must be quite galling for some member states of the UN with like 5 vaccines to go around to see this spectacle.
Absolutely, and this is the real problem. We were just discussing last night with a group of internationals. The people in the United States who are turning away vaccines, and people in the rest of the world can't get them. It's appalling at this juncture, and we can say what we want about strategies of herd immunity. This is a real failure. If you start looking at what it would cost to inoculate the entire world, it's just a couple of days of expenditure that we were throwing into places like Afghanistan, Iraq, and all these wars.
Yeah, obviously we're going to see whether the US and China can hash out something over the coming days. Chris, I want to go to you because there's a new phrase come out of the Johnson administration before COVID or during COVID, global Britain, and one of the good vaccines was invented in England, in the UK, but there's been a lot of criticism globally that they're not doing enough. putting enough into COVAX. Same with all the European countries, essentially. I mean, is this basically showing national interest above international interest, and do you think it's going to backfire?
Well, the difficulty that politicians face, and relevant to our earlier points that were being made about this, actually Israel used predominantly Pfizer's vaccine, right, and they put the doses very close together. Now, what we learned and what Britain did and got castigated for to start with, and now everyone's copying, was to widen the dose interval to 12 weeks. And that does translate into much more robust, much more resilient and long-term immunity. And that may account for why Israel is seeing more breakthrough. Perhaps it's at least partly contributing to that. But the difficulty we find ourselves in, and this is the difficulty that politicians confront, is that we've done good work to get 96% vaccine uptake among some sectors of society. And we've reduced our death rate to very, very low levels in those groups. But if we do need to come back with a booster, and we do need to reinforce the protection in at least some of those groups, if we've committed, or we commit the vaccines elsewhere because we're of the view that they're working tremendously well, what we could end up doing is undermining or pulling the rug from underneath the good work we have done, and we're literally trading a life in one geography for a life in another. And so the politicians are effectively sitting on the fence at the moment. They don't want to jump in case they get the direction wrong, because until the data emerge and either tell us, yes, there are people who clearly do need boosters, and this is the group that need them, and this is when they need them, versus actually they don't need them, and these vaccines are all going free, they don't want to be the politician that then get deselected, that no one will vote for in future because they were the ones that pulled the rug from under the vaccine program. So you can see the difficulty that confronts them.
Yeah, it's that fear of not having enough, and of course overseas constituents don't vote in Western democracies either.
Exactly
so,
right. Exactly
there are no votes in that.
Where's your electorate? Your electorate's at home.
Right, and taxpayers, etc., etc. Joe, I want to finish with you. Just let's look out for the next 3 months. We've got fall coming, and and the winter. This is when viruses tend to spread. What's your prediction politically for how the White House, the opposition, and let's face it, the American public handle this? Because essentially everyone's fed up with it, but obviously there are going to be severe social and economic costs if this virus doesn't go away.
Well, already we're having economic costs. The slowdown, the recovery has kind of stalled in part because of the Delta variant. Looking ahead, it's always impossible to predict exactly what will happen, especially with such a capricious virus. But I believe that we will have to confront another sort of mandate, perhaps even a partial shutdown. It may hurt Biden's chances. It may hurt Democrats' chances to hold on to the House and the Senate. But we are looking at rough times ahead if things do not improve dramatically and in a hurry.
Joseph Williams with the final word. Thank you so much. Great panel from all over the world. COVID is a virus that affects all of us. Really appreciate you being here. That's it for this edition of The Heat. I'm Nathan King in Washington, D.C. Thanks so much for watching. See you soon.